And welcome back to the pathology lectures, where I try to talk about my lectures when I'm reading and try to make sense of it all, often making mistakes, as was seen in the previous video where I got Graves' disease, processing Graves' disease, confused with the process in myasthenia gravis, which are very different. So this time we're going to talk about type 3 hypersensitivity, immune complex mediated. Of course, we're talking about the antigen and antibody complexes and how they travel around and cause trouble. So where do they go? Where do these complexes go? So remember that wherever they go, they're gumming up the works. They're causing trouble. It's like they are sticking to stuff. So for example, in the kidney, they go to the glomerular basement membrane. They go to the blood vessels and cause trouble. The skin, the joints, the synovium of the joints, and they induce an immune response. So what are some examples of the common type 3 diseases? So of course we have the famous and often talked about lupus and poly or periarteritis nodosa and post-streptococcal glomerulonephritis and Arthus reaction, which you might see after an immunization, and also serum sickness. So these are some examples of common type 3 diseases. So let's talk a bit more detail about these. So basically we're talking about so what I want to say here is just to summarize that the type 3 hypersensitivity occurs when the antigen antibody complexes are not adequately cleared by the innate immune cells, and they accumulate and give rise to an inflammatory response, and they attract leukocytes. That's what it says on Wikipedia, so remember that. So what are some examples, again, of the type 3 hypersensitivity? We talked about lupus, we talked about glomerulonephritis, and polyarteritis nodosa, also reactive arthritis, serum sickness, Arthus reaction, Farmer's lung, so many different types. But anyway, that's just a quick example. We can talk now about type 4. So before we talk about some of the autoimmune disorders, so we'll go over what type 4 hypersensitivity is, and we don't talk about this in detail because we have in the immunology lectures. But remember, this is a hypersensitivity is often called delayed type hypersensitivity, and it is T cell mediated. And so how long does this take to come about? Well, the reaction takes 2 to 3 days to develop. And unlike the other types, it is not antibody mediated, but rather is a type of cell mediated response. So remember that type 1, 2, and 3 are antibody mediated, but type 4 is cell mediated. And of course, it's T cell mediated. And we can either have inflammation or we can have destroying, cell killing, and tissue injury. But this is basically a T cell mediated cytolysis. And we have the involvement of cytokines, for example, interferon gamma, tissue necrosis factor. We have the cytokines, for example, interleukin 17, interleukin 22. From the CD4 T cells, we have Th17. Anyway, we've gone over this in immunology. Let's skip over now. We're going to start talking about the immune disorders, autoimmune disorders. So when we talk about the classic autoimmune diseases, we can sort of separate them into systemic and local. So systemic classic autoimmune diseases, can you think of any? Of course, we have lupus, which we talked about before as a type 3 hypersensitivity. We have rheumatoid arthritis, Sjogren's syndrome, systemic sclerosis, also known as scleroderma. We have MCD, or mixed connective tissue disease, and polyoperiarteritis nodosa. So those are how these classic autoimmune diseases present systemically, but how about locally? So can you think about any of the classic autoimmune diseases, how they act locally? One would be Hashimoto's thyroiditis, also autoimmune hemolytic anemia, multiple sclerosis, Goodpasture syndrome, pernicious anemia, myasthenia gravis, Graves' disease, and others. So when we talk about autoimmune diseases, we're talking about failures of the system, and generally we're talking about two big failures. Firstly, the failure of self-recognition, and then the failure of self-tolerance. So what is tolerance? So centrally, this is the death of self-reactive lymphocytes. And peripherally, this develops after T and B cells mature and enter the periphery. So we're talking about these diseases that come about as a result of a strong genetic predisposition, and it is often related to other autoimmune diseases. So when someone gets one autoimmune disease, they're likely to get another, and it is often triggered by infections. So let's talk a little bit about that.